Hello. Good evening, fellow friends and loved ones. It's once again a very awesome privilege to come to your homes to have a wonderful discussion again. Yes, we thank God for an awesome day. Today, the Sunday, the 28th of February. Yes, God has been so gracious, God has been so awesome, and He has given us the privilege to see this day. Yes, the last day of the month of February. Yes, God has been so gracious to us. So we want to continue our discussions. Yes, this discussion month marks the end of February. Yes, so we've had so many discussions in the previous weeks, and then I'm sure today will not be an exception. And so as you're watching, you can just share the page also for other people also to learn from it. You can share the page. There's a point where you can share the page. So we are beginning this presentation in the name of the Father and of the Son and the Holy Spirit. Okay, so today's discussion is on the topic shaking disease or Parkinson's disease. So Parkinson's disease is the scientific name, but the normal name is actually called shaking disease or shaking palsy. Okay, so before we start talking about this condition called Parkinson's disease, we'll be talking about the outline. So we're talking about the definition, the causes, the symptoms, the how to diagnose this condition. We're going to talk about the treatment, be it surgical or be it medications, be it medical wise, and then to the latter point we talking about our next topic. Yes, our next topic. Yes, God has been so gracious unto us and He's been faithful throughout these presentations. And so we'll begin this topic with a quote that states that perfection is not attainable, but if we chase perfection, we can catch excellence, by a man called Vince Lombardi, or Vince Lombi. It states that perfection is not attainable, but if we chase perfection, we will catch excellence. So let's meditate and reflect on this quote. And so we move on to our topic for today. It's titled Parkinson's disease or shaking disease or shaking palsy. So what is Parkinson's disease? Yes, it's a disease, as the topic will mean. Shaking disease, so it means we have a part of our body shaking. So which part of the body? Is it our head? Is it our neck? Is it our hands? Is it our legs? Is it our back? Is it our waist? Okay, so actually this involves the whole body, but it's actually progressive. So we see shaking around the hand part, so the person can't hold things for long. Sometimes at rest the shaking becomes pronounced. Sometimes during activity, lifting things, the shaking becomes pronounced. So we are zooming in to talk about the topic Parkinson's disease. So first of all, you must know that it's a movement disorder. That is, the normal movement is altered. That the normal movement is impeded. Okay, so it's a type of movement disorder that can affect our ability to carry out our daily activities, such as walking, such as carrying things, such as transferring things from one side to the other. So actually it's a movement disorder. It's a type of movement disorder. You have so many types of movement disorders, but then this is one of the type, as a shaking disease or shaking palsy. Yes, it actually affects our daily activities. And basically we have two main types of this shaking disease or shaking disorder or Parkinson's disease. We have the non-motor symptoms, that is where the symptoms that will show are not really concerning you moving from one place to the other. And we have the second one is motor symptoms. So when you have this condition, it presents itself with two types of symptoms: motor symptoms and non-motor symptoms. So non-motor symptoms is actually involves sleep problems. So the person is not able to sleep well. The person has short periods of sleep. If the person sleeps at night for about 2 hours, the person wakes up and can't sleep again. So this is one of the non-motor disorder. It doesn't really involve you carrying out and moving from one place to the other. Then the second one is constipation. So when you have this condition called Parkinson's disease, person is likely to have constipation. That is, not when he goes to the washroom, he finds difficulty in passing out the feces, and so this is one of the symptoms of this condition. And then also, the person has a symptom of anxiety. So the person is so curious to get so many things. Yes, anxiety, and then depression, and then fatigue. So these symptoms might not show up in the early stage, but as the disease progresses, yes, these symptoms begin to show themselves or become more pronounced. And then, more importantly, the motor symptoms. So we have basically about 5 different subtypes of these motor symptoms of Parkinson's disease or the shaking disease. The first one is called the stiffness or rigidity of the muscles. So the muscles become very stiff and rigid. So even when you try to push the hand or stretch the elbow becomes a bit stiff and not able to stretch. Even lifting of the hands up, the person cannot lift the hands up. So the person's hand is always in this position. So as we continue this discussion, that's today, we'll be showing you some pictures, and today promises to be a wonderful day. Yes, there are pictures around to be able to comprehend or understand this topic to the latter. So just stay tuned, just stay behind and watch. Okay, and the second one is, apart from rigidity of the muscles, we have a condition scientifically termed as Bradykinesia. That is slowness of movement. So when the person is getting up, the person gets up slowly and stands, and then actually takes small movement. And even the movement, he or she slides the foot forward, so on the floor. So it moves. If this is your leg, it shifts like this. He's not able to lift the hand, or he or she is not able to lift the legs up and walk as normal as a person without this condition is supposed to. The person also has troubled posture. So the person is not able to stand upright, and the person has trouble in balance. That is, when the person stands, not able to stand straight, is that turned to one side or shifted forward, and this creates instability, and the person is prone to falls. The person is likely to fall at any point in time, and also the person has problem with coordination. So when you ask the person that hold this pen, do this, the person cannot do it. The person's hand even shakes, so is not able to coordinate and move, and sometimes throwing and catching. So in some of the treatments, we engage in various activities that will improve upon the person's coordination, posture, balance, which we'll be talking about very soon. Also, the person has vocal symptoms. So that is when the person is talking, the person has slowness of speech, and the person has difficulty in terms of even recollecting and then speaking in an ordered manner. The person also has walking impairment. That is, the person in walking is not able to walk as a normal person is supposed to walk. Okay, so aside this very distinguishing two features of this condition called the motor and non-motor symptoms, we also have the pathophysiology. That is the disease itself. What does it entail? So one may ask, what does it entail? So actually, this disease actually involves the nerves in our brain. So our brain is also found in our skull, this head. We have something inside we call brain. The Ghana say Dremo, the tree say what brain. Yes, so that is a Ghanaian dialect actually. And then so in the brain we have structures or wires that we call nerves, and these nerves are actually interconnected, and they send information from one point to the other. In the brain we have so many compartments. You have the cerebrum, medulla oblongata. We have so many structures in the brain, and these connections, that is the nerves, help to communicate each other. And these nerves are protected by something we call myelin sheath, and these help to reduce the tendency of them being injured. Okay, and then also helps to transmit information from one point of the brain to the other very fast. So just imagine when something falls on the ground, you turning like this, or you being about to be blown, and then you raise your hand up. There's a swift interaction between the compartments of the brain for you to move your hands or even to do this. And so these actually are very important in terms of the structure of the brain. So when this condition happens, we have disconnection between the wires, that is the nerves, and this causes these symptoms to become pronounced. Okay, so actually you have loss of these neurons, so the wire that's in the brain are lost, and so when they are lost, we have poor connection, that is poor communication. And then when we have this situation, we have these symptoms being pronounced. We have sleep problems, we have poor posture or balance, we have the fatigue, being depressed, and also having stiffness or rigidity of the muscles, and then even the vocal symptoms, that's you're unable to talk very, very, very well. Okay, so actually this condition presents with decrease in the amount of neurons And then in 1911, there was a man called Casimir Funk. He's the first person who diagnosed one of the medications for treating this condition called levodopa. We have other medication called carbidopa, and these two medications, when they combine them together, they are very effective in managing this condition, and the person could live for quite a longer time. So carbidopa and levodopa, these are medications that helps manage this condition. Okay, so as time went on, also in the 1980s, there were so many treatments also that helps to manage this condition. We have the deep brain stimulation, and the other treatments we'll be talking about very soon. And so some very pronounced or well-known citizens in the world have this condition called Parkinson's disease. I'm sure we've heard about this man, Muhammad Ali. So he had this condition called Parkinson's disease. So where we have the shaking, the hands begin to shake and the neck begins to shake. He's not able to stand properly. The patient or the person bends and is not able to lift himself up. Okay, so there are other scientists or the other people who were affected by this condition. I'm sure maybe I don't know this person. He's called David Finney. He was 40 years when he was diagnosed with this condition, which defeats or debunks our theory that says that people who are more than 60 years have this condition. Yes. So, and there were actually so many people who were affected by this condition who we are not really talking about now. Okay, so let's talk about the symptoms into detail. Okay, so actually what causes this condition? There are three main factors or three main causes of this condition. One, we have the idiopathic causes, that is where we don't know actually the specific cause. And we have, secondly, we have the genetic cause, that is where we have it running through the family. So if the father has, if the mother has, when they come together, or if the father or the mother has a recessive gene, that is a gene that doesn't show up in the mother or a gene that doesn't show up in the father, when they meet or they come together and they bring forth, this condition shows itself up pronouncedly, and then the child could have this condition at a later stage of his or her life. And then we have also the environmental factors. The first one is the idiopathic factor, that's the one we don't know. We have the familial factors or the genetic factors, and then the third one is the environmental factors. Okay, so actually in treating this condition we have so many procedures. We have the multidisciplinary approach in treating this condition, but we're talking about it very, very soon. And when we talk about the genetic factor or genetic cause of this condition, one, there's a gene that we call the GBA gene or the Parkin gene, which actually accelerates the occurrence of this condition. And actually this condition has its disadvantage, yes, mostly disadvantage, where we have the fact that the person is not able to perform activities of daily living or is not able to do his or activities as before. Then when we have the environmental factors, we refer to as factors such as exposure to pesticides. So in the olden days, when we used to use spray, not actually olden days, and I think 2000 thereabouts, early 2000s, we used to have spray where we spray our whole room, and some of us we stay in the room and we want to enjoy the spray, or sometimes yes, just be in the room and avoid mosquito bites outside. But then it's shown that exposure to pesticides, that is spray, continually could deplete the amount of this dopamine, the substance in your brain, and this could make you get Parkinson's disease. So if you are exposed to a lot of pesticides or solvents, you could have this condition called Parkinson's disease. And then also if you have repeated head injuries, that is, you've been hitting your head on the ground or you've been hitting your head on to substances, this could also make you predisposed to this condition called Parkinson's disease. The scientists are still developing or establishing the connection between the gene factor, that is, if your mother has or your father has, then you could have, but it's not really established. So other environmental factors also is one, your exposure to caffeine. So those who like to take in caffeine, that is Nescafe, medications or supplements that contain caffeine, you're likely to have this condition called Parkinson's disease. Then also too much exercise. So exercise is good, you can go to the gym, but then if you over gym or you over exercise, then you could also predispose yourself to this condition called Parkinson's disease. Yes, so let's all take a clue from this that we shouldn't exercise too much. Okay, yes, and so the motor symptoms as we mentioned earlier, the motor symptoms, we have the bradykinesia, the vocal symptoms, we have the rigidity of the muscles, and then we have also the shaking, the tremor. So when someone has this condition called Parkinson's disease, the person has tremor, and this tremor is slow. The person shakes to like this. At first, the person shakes, and this actually is rhythmic. It starts from one hand to the other. So when the person is having this condition, or is beginning to have this condition, the person has the shaking on one hand only. But then as time progresses, the person is likely to have it on both hands, and the shoulders, then the legs, and then actually the whole body. Okay, so actually the person has resting tremor, or the neurological conditions such as stroke, and having this condition called a shaking tremor. So we could have the person progressing to have this condition, but someone having a neurological condition called stroke, that doesn't give him, or that doesn't predict that the person has Parkinson's disease. It's just a risk factor for having Parkinson's disease. It doesn't mean that the person, okay, so that doesn't mean that the person could have Parkinson's disease if the person has a stroke. So let's take this into consideration. Actually, the hallmark of this condition called the Parkinson's disease is a resting tremor. So when the person sits down for some time, the person begins to shake, and then is not able to control the movement. So the person actually holds the hand to keep the person from not shaking. So 30% of these people who have tremor progress into the advanced stage of this condition called Parkinson's disease, and the person, as we said initially, that the person could have tightness of the muscles or stiffness of the muscles or rigidity of the muscles, actually is a clear sign of Parkinson's disease. Okay, so the person could have also bradykinesia, that is slowness of movement. The person could have postural instability. The person could have walking difficulty. The person, when the person is taking steps, the person takes steps slowly, one after the other, and then the voice also diminishes. So when a person is talking, the person talks loudly, and then the sound diminishes with time. These are all symptoms, but that doesn't confirm someone to have a Parkinson's disease. We have diagnosis procedures that, when are carried out, they can really diagnose this condition as Parkinson's disease. So aside that, we mentioned that the person has sleeping problem, that is inability to fall asleep, that is scientifically termed primary insomnia, and then the other one is the inability to stay asleep. So the person sleeps for some time, short while, and wakes up, and this is also called secondary insomnia. Actually, the person begins to talk in the dreams, actually, when the person has this condition called Parkinson's disease. But as we are saying it again and again, it doesn't confirm the person has Parkinson's disease. They are all symptoms, but the person could also have depression or anxiety, as I mentioned earlier on. And so there are so many symptoms of this condition. The person could also be fatigued, getting tired easily with activity. Okay. The anxiety actually could be mild, could be moderate, could be severe as time progresses. Also, one significant symptom is the person progresses in terms of increase in weight loss. So the person is not able to keep his weight at a stable level. So when the person checks his weight, the person begins to have reduction in weight as time goes on. This is mainly due to people who are more than 60 years, as that's the elderly in the society, and the person also tends to have confusion when the person progresses in taking the medications. So some of the side effects of medications include confusion. So it's advised that we engage in various therapies also that could help to manage the confusion that the medications present themselves. Actually, there is one very important note that we should just keep in mind, and that the condition is progressive. Yes, the condition gets worse as the day goes by, but then there are medication that slows the progression of this condition. The person also could have swallowing problems. When the person takes in food, the person finds difficulty in swallowing, that is, swallowing takes quite a longer time. The person also could have lightheadedness, that is, the person feels light in the head. Okay, so we've talked about the symptoms, yes, and so now we are moving on to, let's see the tests. So first of all, let's just mention one other symptoms of this condition. The person could also have a scientific term that we call postural hypotension or orthostatic hypotension. That is, when a person moves from sitting to standing, the person feels dizziness, and then at any point in time the person could fall. So when this person is diagnosed with a condition or experiences other symptoms, the person is taken or told to take caution in terms of when he or she is moving from sitting to standing. Otherwise the person could fall. Yes, okay. So we talking about other symptoms. Also, the person has urinary incontinence. That is, the person is not able to control urine at any point in time, in terms of either the frequency or the urgency. That is, the need to urinate very often is increased, and also the urgency to urinate is also increased. So at any point in time, the person is eager to go and urinate. Okay, and actually, one very important note is that the urine symptoms of older person actually could be related to a condition we call prostate gland issues, that is prostate cancer. But that doesn't mean that the person with the symptoms of Parkinson's disease has prostate cancer. There are other tests that helps also to confirm whether the person has that condition or not. The person also experiences excessive sweating. So someone having Parkinson's disease sweats a lot. So this is because there is increased metabolic activities. That is, the shaking itself is also an activity. So this causes the pores in the skin to open up, and then for the person to release the sweat very often. Actually, this condition, the sweating aspect, affects mainly at the upper part of the body, as the hands, the face, the nose. Actually, the person sweats a lot in this area. As we are still hammering on, the condition is actually progressive. The intensity and the severity of this condition actually progresses with time and with age. So, how do you diagnose this condition? How do you diagnose this condition? There are very classical signs of diagnosing this condition. Actually, the neurologist, that is the one who studies the brain, or a specialist called a movement disorder specialist, he or she is very, very importantly needed in diagnosing this condition. Other multidisciplinary team members will be involved in terms of treating this condition, but the neurologist is very, very important person who is required to be able to confirm or to diagnose this condition. Actually, he actually asks the patient, the medical history, what happened to the patient, so many questions, and then checks the BP while standing and sitting. Also checks the memory ability, asks the patient questions: what did you eat this morning, what did you wear yesterday, just to see whether the person has a memory deficit. The person also examines the facial expression, where the person laughs a lot. The person could have a masked face. That's one of the symptoms of this condition called the masked face. And also the specialist also looks out for tremor in the face, the hands, the arms and legs. That's the movement, shaking movement in this part of the body. The person also examines for stiffness, so holds the hands and stretches forward whether there is stiffness in the elbow or the shoulders, and these are classical signs of diagnosing this condition. And then, to be very, very emphatic, the person or the specialist asks the patient to stand. So in standing, the patient is also likely to move slowly from sitting to standing, and then this also gives us a very good clue or indication of the person having this condition called Parkinson's disease or the shaking disease or the shaking palsy. Actually, we assess also for the balance. The specialist assesses for the balance as to when the person can stand on one leg or the person can move in a straight line. Okay, so these are one of the ways of diagnosing this condition called the Parkinson's disease. There are other diagnosis tests, that is using the MRI scan, that we can see through the brain, so that we can see whether there's depletion in this content or this chemical substance called the dopamine, and then we can also confirm the condition called the Parkinson's disease. We also have other tests. We have the PET scan, we have the DAT scan, which actually see the amount of dopamine function in the brain. That's the activity of the dopamine. Actually, there's no biological test for this condition called the Parkinson's disease, but scientists are still finding out a biomarker to be able to diagnose this condition called Parkinson's disease. Other scientists also are trying to see whether these bodies that we mentioned earlier on, the Lewy bodies that tend to increase or accelerate this condition called the Parkinson's disease, we can find a way of having an anti medication for these Lewy bodies. This will help to reduce the deterioration of the condition called the Parkinson's disease. Okay, so we are talking about the diagnosis procedures. So, which people are involved in treating this condition called the Parkinson's disease? We have first of all the neurologist. That is we have the neurologist, and then we have the movement disorder specialists, we have the physiotherapists, we have the physician assistants, we have the nurses, we have dietitians, we have social workers, we have occupational therapists, we have neuropsychologists, we have speech therapists when the patient or the person has the vocal symptoms, we have the primary care physician, that's the family doctor, and then many more, that's the relatives of the patients. Also, there are other possible conditions that could mimic or could look like this condition called the Parkinson's disease. We have the medication side effects of this condition, that is, we're talking about the confusion status. Also, we go to have a condition called the Parkinsonism Syndrome. These are also a similar one to the Parkinson's disease, but they are early stages of this condition. And then we have the multiple system atrophy. We also have the progressive supranuclear palsy. We have cortical basal degeneration. These are all scientific terms. I'm sure they look very new to you. Yeah, but there are other conditions that could look like this condition called Parkinson's disease, and so we have to just take a note of it. So, how do we treat this condition? There are so many things that come into play. They are interplay. Okay, first of all, we have medications, because the medications also slow the depletion of this chemical substance called the dopamine, and we have to take note of it, that this condition is caused by depletion or reduction of the amount of dopamine in the brain, in the part of the brain called the substantia nigra. It's in the brain. That is where the chemical substance called the dopamine is stored, and this helps to control our movements so that we don't shake, we don't become so anxious, we are at a relaxed state. So in treating this condition, we have medication that we take. We have one for the motor symptom, that is where you have the shaking and the slowness of movement, we have the rigidity of the muscles. We have a medication called the droxidopa. Yes, and this helps to control the dizziness that we feel when we get up from sitting to standing, that we are likely to fall. So this helps us to control and prevent us from falls. Actually, this medication also has side effects, so we make sure that if you have a heart disease, the doctor is able to find a way of managing the two conditions at a go. We have other medication. You have the fluorocortisone, you have the pimavanserin, so many medications, and then they also have their side effects. We have the rivastigmine, for people who are likely to have memory problems, memory issues, and the other side effects actually which we take into consideration before giving medications for this condition called Parkinson's disease. Actually, we have side effects such as nausea, that is feeling to vomit, and also vomiting, and then loss of appetite. So these are some of the side effects of taking this medication called Droxypa and the others. Okay, so we treat this condition, medication, and then very importantly our diet. So the dietitian is also very important in treating this condition. So I know my other colleague dietitians are also watching, and they know the very important role that they play in treating this condition called the Parkinson's disease. So I'm just going to take a little bit of their profession. Okay, so we have intake of vegetables and fruits. So it's advised that we take a lot of vegetables and fruits to reduce the tendency of having this condition for Parkinson's disease. And when we are likely to have it also, we make sure that we take in more of them because they contain micronutrients that help to improve the function of the nerves in the brain. Also, we advise to take in a lot of water. Just I'm having some water beside me, so just take a lot of water, a lot. So we need to take a lot of water, and water intake helps refreshing our system and helps us to have a good thought mind. Okay, so aside the water, you also have to avoid taking in caffeine, taking in alcoholic beverages. So those who like drinking alcohol, you are likely to have this condition called Parkinson's disease. So please, let's avoid taking alcohol. And then caffeine, and also taking more of legumes, taking nuts, taking moderate amount of low fat, that's as chicken. Avoid taking too much chicken, and then fish, and then taking more of nuts, and then low fat proteins, example chicken and fish. So taking in fish is good in terms of minimizing the occurrence of this condition called Parkinson's disease, and taking more vitamins, fruits, orange, and then nutritional supplements. So supplements that contain these vitamins also helps to manage this condition called Parkinson's disease. We have antioxidant supplements that helps also to manage this condition called Parkinson's disease. So diet and medication is very, very important to manage this condition. We have the taking in yogurt, taking in meat. Actually, it's not the best. Yogurt and meat it stays. Scientists have research has come to confirm that they affect the absorption of this medication called the levodopa. Yes, so when you're taking more yogurt or meat, it doesn't allow the medication levodopa to function. So if you have someone who is taking in levodopa or carbidopa combined, it's advisable not to take in meat or yogurt because they are going to hinder the very amount of or the dosage of the levodopa from entering the system and having its maximum function. So aside the medication and then the food, that's diet, we also have therapy, that's exercises that helps also to be able to manage this condition. We have regular exercises such as walking, we have cycling, we have swimming, we have dancing. So outside we have music therapy where we engage people with having this condition and then engage them in dancing practice, and this helps also to improve the movement function and then the overall being, the general being of the patient. Motor complication of this condition, that is where the movement is impaired, they're unable to do the activities of daily living very effectively. And so they are confined to one place for a longer period of time. So aside this exercise, aside the medication, aside the diet, when it looks very, very advanced in stage of this condition called Parkinson's disease, we resort to the last option, surgery. So the person goes through surgery. We have a procedure called a deep brain stimulation, and this actually implants a permanent electrode, that's a thin electrode, into the selected parts of the brain. And actually this is battery operated, and this helps improve upon memory. Also, it also helps improving upon the communication, that is the nerve to nerve communication or neuron to neuron communication. And this helps also the person to carry out activities living very effectively. Okay, you also have the focused ultrasound, and also this helps to treat tremors in the patient who has the Parkinson's disease. Okay, so we've talked about the surgical approach, and I'm sure we've learned a lot from today's presentation. We've said so many things. We talk about the definition, the causes, the symptoms, the history, the prevalence. We talked about the types, the people who are affected. We've talked about a lot, the causes. We talk about how to diagnose this condition called Parkinson's disease and how to treat them, being many, the diet, the medication, the exercise. And then when all is tried and all options are sought to, it doesn't work, we go through the surgical means or surgical procedure. And then prominent people who are affected by this condition, we have the Muhammad Ali, and then David Finney, a professional cyclist and an Olympic medalist. Okay, so I'm sure we've learned a lot from today's discussion, and you'll be in the best position to tell other people this condition. And so before we end, let's look at some pictures which we promised. Actually, I'm sure we kept long, but then we just want to look at some pictures so that okay, so yes, so okay, so this is actually the classical sign of this condition. I'm sure we can see it now very, very visibly. Yes, you can see the tremor there, as I was talking about here. This is the tremor. Person has tremor around this region, dysfunction. Person has these features, problem swallowing. Person has pain. Actually, also the classical kind of this condition called the pain around the arm. The person has tendency of frequent falls. That is because of the tilt posture forward, as you are seeing here. The person is likely to fall forward and then hit the head on the ground, and this injury or head trauma could accelerate this condition called the Parkinson's disease. Okay, the person could also have, in the advanced stage, the person could also have drooling, that's the mouth saliva coming out from the mouth. Okay, so these are some of the classical signs of this condition. We have as we mentioned earlier on, the bradykinesia, the vocal symptoms, the rigidity, the tremor, the walking difficulty, mental behavior issues, the sense of smell. So the person also have difficulty in smelling, sense of smell is impaired. The person sweats a lot as a result of the cells being cancerous. The person also have digestion issues, that's the gastrointestinal issues, and the person has pain. Okay, so these are some of the pictorial presentation. That's the description of this condition: being headache, being shaking the leg, and difficulty movement, that is imbalance issues. Okay, so this is actually a very classical presentation. The person has a bent, as the person's body is bent forward, the posture is bent forward. The person cannot straighten up because of this condition. So this is an MRI showing this condition called Parkinson's disease. So this is the healthy brain tissue. Then this is before the Parkinson's disease. So this is after the Parkinson's disease. You can see that this region is actually not as compared to this. You can see this is the dopamine. This structure is dopamine. And you can see that this is progressively diminishing, and then this is totally diminished. So we have no dopamine around this side. Okay, so these are the classical presentation: depression, disorders, weight loss, orthostatic hypotension, as we mentioned earlier on. Okay, so these are the brain. This is a brain, as I was mentioning. It's in our head, in our skull. Okay. So when you have lack of dopamine in the brain, could have Parkinson's disease. Okay, so this is actually the substantia nigra. So this is, if you see the brain, this is the brain here. So the substantia nigra has been projected here. So this is how it looks like. And then around this region is where you have the nerves connecting and transmitting information from one point to the other, and helping the dopamine to be maintained in terms of production. Okay, so this is the Parkinson's disease. This is the presentation. This is actually a summary of what we talked about so far. Okay, so we can have the digestive issues with Parkinson's disease, and this is also a summary of what we're talking about so far. Okay, tremor, the dopamine reduction. Okay, so this is the okay. So the person has shaking. So the person presents his hand here. Yes, the person shakes. So the person puts one hand on the other to avoid shaking. So this is also a summary. Okay, so lots of movements here. The person has tremor, speech language. The person cannot talk well, memory issues. So this is a summary of what we've been talking about so far. I'm sure we are learning a lot. So as we said, this is actually a progressive condition, and those who have issues in terms of sight are actually a lot. So they have issues in terms of our sight, and those without Parkinson's disease have lesser. So this is an MRI showing the disease, so the Parkinson's disease. So this is the normal brain. You can see the dopamine level here, normal, but as compared to this one, you see depleted. Okay, so after the Parkinson's disease, that is, the person takes the medication, exercises, it helps to return back the normal function of the substantia nigra by producing more dopamines. Okay, so this is a summary. Another one. So these are the nerve connections. Okay, so you can see the Parkinson's disease. You can see the substantia nigra here, and then the other structures that compose the substantia nigra. Okay. So you can see someone who is being taught. The person has coordination problems. So when you ask the patient, the therapist asks the patient to point the finger, but when the woman was pointing, the woman couldn't hit the finger and pointed away. So these are signs of incoordination. Okay, so wow. Yeah. So I'm sure we've learned a lot from this presentation, and so we'll be hoping for the next topic, that is next week, and let's all stay tuned. So next week we'll be talking about the condition called the Alzheimer's disease. Let's stay in tune, and I'm sure we'll have a lot to learn about this condition called Alzheimer's disease. If you have any question, your questions are welcomed, and then I'm sure we'll learn a lot next week. Okay, so I'm sure that St. John, St. Martin, and St. other people who came in and went out. Okay, thank you very much for your time. May the Lord be with us all. Have a blessed evening. Have a wonderful week. Tomorrow begins a new month, and may the Lord continue to protect us. May the Lord take us through the month of March and protect us, and see you next week by this time. So next week we're talking about the condition called Alzheimer's disease. Have a blessed and wonderful week, and take care. Bye.